Hello everyone. Today I am going to give you some tips about how to make oral presentation. Most students don't feel comfortable having to make a presentation in front of a crowd, as they might feel that they don't have enough experience. That might make them feel a bit nervous. However, there are some techniques you can use. If you learn these techniques, I think you can expose yourself to the public with no fear. After you have chosen your topic related to your major, you will do some research about it, and then you will prepare your slides on PowerPoint. So in this session, I'm going to show you some do's and don'ts while preparing slides for your presentation. We will be working on organization, content, and structure. Now let's get started. How to prepare good PowerPoint slides. Now look at the right side of this slide. Here you see some tips about how to prepare a slide. First of all, slides should be large, simple, and clear. Content: you should avoid too many colors, too many words and details. Font style: do not use italics. If you want to emphasize something, you can use colors. No all capitals, again it might be disturbing. And when you finalize your slide, you need to check spelling. As for the lines, no unnecessary words or no full sentences. So you are not supposed to write full sentences, just write some prompts, and that might be helpful while talking about your topic, but no full sentences. If you want to make your presentation colorful, of course you can use colors, but you need to use contrasting colors, and I'll show you some examples later. And visuals: avoid crowded backgrounds. Here is a good example of a slide. Information is given simply and clear. Also, it's large enough for your audience. Don't forget that we prepare slides not only for the audience, but also for ourselves. The prompts on the slide should remind you of keywords that you are planning to inform the audience about. Assume that your topic is about sinusitis. As you see, it's easier to follow the steps. Common signs and symptoms of chronic sinusitis include nasal inflammation, thick, discolored discharge from the nose, pain, tenderness and swelling around your eyes, cheeks, nose and forehead, reduced sense of smell and taste. Okay, now let's compare it with this slide. What about this one? As you see, this slide is too wordy and hard to follow for you and for your audience. So it's a bad example of a slide. Let me explain why it is not a good idea to write everything on a slide you are planning to say. It's a good idea to memorize key phrases because they remind you of what you should say, but if you write everything, then you feel like you need to memorize every single word on the slide. And that makes you more nervous because you may forget what to say during your presentation. If you look at the slide to find the information, it won't be easy to find it as the slide is too crowded. Okay. Avoid too many colors, too many words and details. It's not a good idea to put everything on a slide. For example, if you want to talk about symptoms of sinusitis, you can group them and put them on different slides. On the first slide, you may talk about common symptoms, and on the other slide, you can mention other symptoms, such as severe symptoms. What about this one? As you see, too many colors, too many words, highlights, unnecessary details. If you try to use that slide, you will probably fail at the end. Okay, now let's focus on the font style and lines. Try to present this on your own. Which one is easier to use? Of course, the one on the left. You can easily see the title and the subtitles, and just looking at them, you can make sentences. You know, you are supposed to talk, not read during your presentation. Using visuals make your presentation fruitful, nice, but if you use crowded background and lots of visuals, that might distract the audience. So, do not use excessive visuals or weird colors like red on the green screen. That tires you and the audience. Now let's practice. Assume you are planning to make presentation about common cold. As you remember, we are not going to write full sentences on the slides. On the right, you will see the text that you are going to use. And on the right, you will write the keywords only. That will be the slide you will be using during your presentation. Please stop the video for each slide and do the task and move on. When the slides are ready, go back to the first slide and try to talk about common cold without looking at the text. The common cold is a viral infection of your nose and throat. It's usually harmless. Many types of viruses can cause a common cold. Most people recover from a common cold in a week or 10 days. Symptoms might last longer in people who smoke. Symptoms of a common cold usually appear 1 to 3 days after exposure to a cold-causing virus. Signs and symptoms might include a runny or stuffy nose, sore throat, cough, congestion, sneezing, and low-grade fever. If you have a severe throat, headache, a sinus pain, you should immediately see your doctor. A cold virus enters your body through your mouth, eyes, and nose. The virus can spread through the air when someone who is sick coughs, sneezes, or talks. It also spreads by hand-to-hand contact with someone who has a cold, or by sharing contaminated objects such as utensils, towels, toys, or telephones. If you touch your eyes, nose, or mouth after such contact, you're likely to catch a cold. There are some risk factors that can increase your chances of getting a cold. For example, if you have a chronic illness, you may easily catch a cold. Also, smoking weakens your immune system, so you may have more severe colds. So far, we have worked on how to design slides. Now, let's focus on how to create content and language. We need to put all the information in a logical order with necessary transitions. As in writing an essay, we also need to organize the information. That is, introduction, body, and conclusion. Let's first study introduction. First of all, you need to introduce yourself to the audience, like, "Hello, I am Birol Türkmen. I'd like to welcome you all." Here are some examples to start your presentation. Today I'd like to talk about common signs and symptoms of chronic sinusitis. Or, today I'd like to talk about how to diagnose migraine, how to avoid food poisoning, steps of stretching techniques, how to feed newborn babies. Or you can start your presentation with that. I want to show you the risk factors of getting cold. Or I want to show you how to avoid common cold. I'd like to present the steps of giving injections. I'd like to present the importance of patient care. Or I want to show you how to change dressings and how to remove sturs. Or also you can start your presentation like that. I intend to talk about children with ADHD, attention deficit hyperactivity disorder. Or I intend to give information about schizophrenia. Or I intend to explain how to deal with children who have Down syndrome. What about body and conclusion of your talk? After you announced the topic you are planning to talk, you can use these transition words. For example, for addition, let's first look at. Let me start with. Now I want to move on to. In addition, also. If you want to highlight something during your talk, then you can say, here I'd like to point out, etc. If you want to make contrast, then you can say, however, or but. If you want to give an example, then you can say, for instance, for example, or to illustrate. To bridge, you can say, let's turn to, or this leads to. For conclusion, you can say, in summary, as a result, in conclusion, and consequently. Okay, now let's make use of them. Assume your topic is food allergy. Topic: food allergy. Introduction. Today I'd like to talk about food allergy. Food allergy is an immune system reaction. The body gives reaction after eating a certain food. Addition. Let me start with the common food allergy signs and symptoms. Swelling of the lips, face, tongue and throat or other parts of the body. Wheezing, nasal congestion or trouble breathing. Abdominal pain, diarrhea, nausea or vomiting. Dizziness, lightheadedness or fainting. Spotlight. Here I'd like to point out that food allergy is different from food intolerance. Food intolerance is a less serious condition and it does not involve the immune system. Addition. Now I want to move on to a severe allergic reaction, anaphylaxis. In some people, a food allergy can trigger anaphylaxis. This can cause life-threatening signs and symptoms. Contrast. For a minor allergic reaction, over-the-counter medicine may help reduce symptoms. However, they cannot treat a severe allergic reaction. Example. Food allergies are commonly triggered by proteins. For instance, when you consume peanuts, eggs, cow's milk, or wheat, they can trigger an allergic reaction. A food intolerance may cause the same signs and symptoms as a food allergy does, such as nausea, vomiting, cramping, and diarrhea. Pollen food allergy syndrome affects many people who have hay fever. To illustrate, certain fresh fruits and vegetables or nuts and spices can trigger an allergic reaction. Bridge. So let's turn to symptoms. Food allergy symptoms usually develop within a few minutes to 2 hours after eating the offending food. Conclusion. In summary, for some people, an allergic reaction to particular food may be uncomfortable but not severe. For other people, an allergic food reaction can be life-threatening.
Marketing is the activity set for institutions and process for creating
most girls I...
Can you call me back? I'm having a presentation right now. Yeah.
have the value for customers, clients, partners, and society at large. Values for customers.
Writing does not meet task or mission content. Point to lack